I'm here with Dr. Brian Lee. He's a transplant hepatologist specializing in patient care before and following a liver transplant. His research focuses on improving health for patients with alcohol use disorder and alcohol-associated liver disease. Welcome, Dr. Lee.
Thanks for having me.
So speaking about, alcohol-related liver disease, we know that many people are under a tremendous amount of stress these days, whether it's COVID-19 or the economic impacts that are hurting a lot of families out there. And some turn to alcohol to cope. And we know that alcohol plays a large role in liver disease. Can you tell us a little bit about what we're doing in that regard?
Yeah, alcohol-associated liver disease has been increasing, for decades now, but it's been especially so during COVID. So between 2019 and 2020, alcohol-related deaths went up 25%. To give you more numbers, right? Alcohol is the third leading cause of preventable death. 15 million Americans have alcohol use disorder. 2 million have cirrhosis, which is end-stage liver disease. In our world, which is in medicine and liver transplant, half of liver-related deaths are due to alcohol, and alcohol is now the leading cause of liver transplant. So we're seeing this more and more, and especially amongst young adults and women. At Keck, to see 20-year-old women come in with liver failure from alcohol, it's very, very unsettling.
It's distressing. Clearly there's a huge unmet need there regarding this alcohol-related liver disease. And also what can be done to prevent it and what can be done to help those suffering from it. What are the initiatives that you're working on, Dr. Lee, in this regard?
So, alcohol is such a complex disease. I'm very subspecialized, which is, liver transplant. But it's really important to step back in that, alcohol is a disease that affects the brain, which then affects the liver, but also the heart, the pancreas. It increases your risk of stroke. It increases your risk of cancer. It's very much, this complex multi-system disease. So I think at Keck, for example, we're very well suited to be able to treat patients with, alcohol use disorder and liver disease because we have such a breadth of experience and expertise. So something that I'm very excited about here at Keck is that, for example, we're trying to meet the patient kind of where their needs are, which is really this holistic, multidisciplinary, patient-centered approach. And one example of this is that we're trying to establish this USC multidisciplinary TRAIL clinic, which TRAIL stands for Transplant and Alcohol Integrated Liver Clinic. And patients, you hear them, they have all these doctors to treat their disease, and they're shuttling from doctor to doctor, and they're having doctors who don't really work together that often, and it's very, very hard for the patient, right? It's complex, it's inconvenient, and in the end, it's suboptimal care. So we're trying to address this with this clinic by having them see different providers that they need under one roof in kind of one day.
Only at an academic medical center could you really do that, right? With the subspecialists that you have all collected together and all centered around that single patient, I think is marvelous.
Yeah, it's a huge initiative for sure, and it takes investment, and only large academic centers with the resources can do this, but it really is the best thing for the patients.
Yeah. Your overall approach to patient care, Dr. Lee, in terms of what's your true north as it pertains to interacting with your patients?
These patients, I've kind of said over and over that they come from all different walks of life and they have different levels of complexity. I think the most important thing in your approach is to try to find understanding, try to find that empathy. That's the most important thing, actually taking the time to try to get to know your patient, to see where they align in kind of all these different kind of levels. So you can try to work together, right? In the end, you certainly probably have the common goal, but to get there will be different, patient by patient. So to find that first approach, trying to find where you meet is the most important thing.
Well, your approach has been that way. I've heard many great things about you, Dr. Lee, in terms of your practice, and what that all spells out to me is the compassion you come to work with every day and the compassion you have for your patients. And we are very grateful to have you at Keck Medicine of USC, and always delighted to hear your name come up in various circles and the great work you're doing for the patients in our communities. And our hats off to you.
I feel very lucky to be here. Thank you.